on the coronavirus story, and we're now joined by Kevin Mutai. He is at the Likoni ferry. Kevin, what is the situation there? Are people keeping a social distance, and how are they being handled by the authorities?
Well, good morning to you, Olive, and that is the reality that is sinking in, especially when we come here at the ferry. Commuters are now considering and following the government's directive and maintaining social distancing, and this has also been taken as one of the key areas of great concern by the authorities, the health officials. And of course, they are always here to make sure that commuters at the crossing channel maintain the social distancing. You can see that some of them are currently from the Likoni channel, as well as some are also boarding the ferry towards the other channel. But currently, right now, the traffic is on the other side, and residents have been given priority. And this is according to the new measures that were put in place after leaders and the law enforcers met, and there are specific guidelines that are currently working here in the crossing channel. And as I said, that the common mwananchi, the commuters, those who are traveling on foot, have been given priority, and the ferrying of vehicles will begin at 11 to 2. And of course, also those with special access have been granted permission to cross, and those include medics and every other institution that has been classified as essential service provider. But let me quickly bring in the Mombasa chairman for the Kenya Red Cross, Mohamed Noor, to just give us and bring us into perspective on how these current measures are working. We've seen different measures being implemented here from Friday. Is it working so far in terms of the congesting traffic from the crossing channel?
After the issues that we were trying out last week, today will be the first real test for us, because it's a Monday. So Monday we expect a lot of people to cross on the other side. So as from yesterday, we started the new measures, where we between 5 in the morning until 11, we only allow pedestrians, because we know most of the users who come in here are pedestrians. And then from 11 up to 2 p.m. we allow vehicles only, and then from 2 p.m. we concentrate on the island side to take people back to the mainland. But in between, we also have special provisions, like for fresh produce. We allow the trucks to come in between 7 and 7:30, and also because of the high tide, the only time that the big trucks can cross is when it is during the high tide. So we've also allowed that to work out at 10 in the morning.
And then again, as at yesterday, the government confirmed 4 more positive cases persons infected with COVID-19. That brings the total number to 42. Now, the challenge is now tracing the persons who had come into contact with these already confirmed cases. It's a big challenge to the health authorities. How far are the officials here in Mombasa in terms of tracing the persons who came into contact with the cases here in the coast region?
We have a team that is multi-agency, which also the Kenya Red Cross is part of, being spearheaded by the county government, because they run the health docket, the public health department, and also the security and national government. Because the only way we will be able to win this war is by tracing the people who have come into contact with some of the affected persons. It's a very tough work, because if you consider the confidentiality whenever you are dealing with health cases, but we wish if it was not for that, even publishing some of the names or sensitizing people, like you see the DG's case, after it came open, because he's a leader, a lot of people now are coming to us and saying, I was in contact with him on this particular day, I was eating nyamachoma with him on this day, I served him on this day. So I wish there was a way. But I think that also the health workers are constrained in terms of the laws. They cannot disclose some of these names. So we entirely rely on the persons to give us information on the people that they have come across.
When you look at the entire coast region, we have 6 cases in Kilifi, 3 in Mombasa, and 1 case in Kwale. That brings the total number of infected persons in coast region to 10. And health officials are raising concerns. Perhaps these numbers could could increase exponentially. And when we bring that perspective to here at the Crossing Channel Ferry, where hundreds and hundreds of commuters depend on these services daily to cross over, what are some of these measures that you've put in place as part of the key stakeholders to ensure that the spread of this virus is kept at bay, especially and specifically when we speak about here the Likoni Channel, because this is where a lot of people are crossing at once every day?
For me and also for the government, I think there is no place in this country as the Likoni Ferry, where you're having a concentration of around 10,000 people every 1 hour and exposing them to the virus. So be it. So what actually we will want to let the people know, safety starts with them. As long as people are being forced by the security personnel or the people who are enforcing it here to wear masks, then we have a problem. As long as people are being forced to keep the social distance, then we have a problem. I think what we need to encourage our people is safety starts with you. So follow the regulations and the rules that have been put in place, not for the government, but you are doing it for yourself.
I'm glad that you're bringing that point, because we've had challenges reported by the authorities, the law enforcers. There's a total disregard by some of the commuters who are constantly defying some of these measures. This could probably punish maybe other commuters who are following these guidelines, because as I can see right now, quite a number of them have face masks, but there are those who don't have. Don't you think they're also exposing, perhaps even creating more danger to those other persons?
I think we need to sensitize our people more. I think there are so many rumors that are moving around, and some people still believe that this coronavirus is not for them. We need to sensitize people more. We need to show people the images of what is happening in Italy, in Iran, and also in other parts of the country. But most important, we need to use all the existing networks to talk to the people and sensitize them. I know there are so many concerns and that people feel there are some areas where they are still lumped up together. But every day we will be improving and improving. But our people must learn that COVID is real. And if you do not take that personal safety upon yourself, then even the government forcing you, because I will force you here at the ferry, but when you are across there at your own home, you are doing something different. So people need to understand that we have this, we are vulnerable, and especially for this crossing, because I will call this the center for coast, because it connects Kilifi. A lot of people who are coming here are coming from Kwale. So when we have a problem at the ferry here, then we will have a catastrophe in the country.
And then again, you know what we witnessed on Friday last week when it comes to traffic. There are certain commuters who defied the orders, and they ended up in the wrong way with the authorities. There was a stampede that even led to several other people being injured because of a few individuals who could not follow the orders and guidelines as required by some of the law enforcers. So today is on a Monday, and we're expecting perhaps the traffic could be probably maybe even worse in the evening. Are there any specific measures that have been put in place to avert whatever occurred on Friday?
As I said earlier, every day we are learning. Every day we are because this has never happened probably even for 100 years. So this is the first time. So what we are doing, the measures that the government is putting in place in consultation with a lot of other stakeholders, is whenever we see there is a room for improvement on a particular area, we improve. So our hope is today we will be more prepared. I think even the law enforcers are more prepared, even in their response. But most important also, we just hope that the people will also not instigate some of these issues by trying to break the laws. But most important for our law enforcers, it's good for them to have a response that is not extreme on the other side. Yeah, but for the meetings that we've attended all through, led by the regional commissioner, the police and different agencies, including the county government, I think we've put in measures, and we are very flexible to change some of them so that we avoid to accommodate special things that come up. Yeah.
And then again, when we look at, when you talk about the tracing of the contacts that had, the people had come into contact with some of the positive cases that have already been confirmed, we look, these numbers could probably maybe even go up. And here we are talking about people who have been in self-quarantine maybe for the last couple of days, maybe even weeks, maybe some are even getting into their first 14 days of mandatory self-quarantine. And perhaps maybe the government is now set to conduct mass testing. Do we, I believe you are also kind of involved in, maybe you have some knowledge or some information on how this perhaps will be conducted. Are we ready? Do we have the necessary equipment, enough equipment to ensure that when that particular exercise comes in, or rather begins here in the coast region, that everything will be good and go, will be good to go? Do we have proper equipment and enough equipment in place?
I think for testing, whatever the CS in Nairobi, Mutahi has done so far, and the government in general, and also last week he announced the 20,000 testing kits that came from China. So on the government side, I think the preparedness is there. The biggest challenge that I foresee is, for example, the whole of Coast Province, where we are serving almost 4 million people, we only have 40 ICU beds. The biggest problem is ventilators, and it's good that the minister spoke of bringing around 1,000 ventilators, because that will be the best problem. But for me, why we should stop? We should not try and reach that level, because once we reach that level, if countries like Italy and other better equipped countries are not coping, then we cannot cope. So our best way is to stop it from spreading now.
Thank you so much for your time. Well, all of you heard it. That was Mohamed Noor, chairman the Kenya Red Cross here in Mombasa. He's part of the key stakeholders together with his team sitting with health officials, the law enforcement officers, to ensure that the key measures that are being put in place will help in keeping the deadly virus at bay. And of course, also we are still monitoring several other places within the county. Remember, Coast Region has 10 confirmed cases, Kilifi County leading with 6, followed by Mombasa County with 3 cases, then Kwale County with 1 case. And remember, the government is still continuing with the tracing of other people believed to have come into contact with the confirmed positive cases. But of course, also the health authorities are appealing to members of the public to come forward with information to also help health officials to make their work easier in tracing these individuals. But remember also, I've also read in the papers that there are also some members of parliament, I don't know if some are from this region, that are currently, or rather they've been recommended for testing. And remember, this is something that health officials, the law enforcers are recommending for everyone to take preventive measures and of course follow the guidelines outlaid by the Ministry of Health and of course the government, to ensure that they stop the spread of the virus. So we will be here, we'll be traversing different places in the coast region, not only here at the crossing channel, but of course we will be bringing you up to speed on what you need to know with regards to the government efforts in curbing the spread of COVID-19, which has so far infected 42 people here in the country, and of course has also contributed, or rather led to the deaths of thousands of other people globally, with thousands others infected. Olive, back to you in studio.